Hello, I'm Dr. Jeff Shad here at MI Surgical, Minimally Invasive Surgical. In our clinic, as I explained in my video earlier, we have a pulse wave machine that does electromagnetic shockwave therapy. She's actually is one of my staff member, at the same time a patient of ours who has tried this once. This shockwave therapy is very effective for treatment of musculoskeletal disorders, tendinitis, bursitis, plantar fasciitis, anything that has itis, means inflamed tissue. It works fantastic for MSK, musculoskeletal condition. This machine called Pulse Wave does a shockwave treatment. And as you see, you could do it for the neck, shoulder, elbow, hand, low back, lumbar region, which is lower back, pelvis and SI joint, which is the pelvis joint and the joint right by your tailbone, pelvis, hip, knee, and foot for plantar fascia. Pick a body part. Each body part, occasionally, if you're treating front and back of the shoulder, because it's a big region, or a hip, you could use 2000 because there might be various part of the rotator cuffs that you're treating and that require additional treatment. So you could increase it, click on it, and you could simply change it to 2000. Okay, and now we got it set. So very gentle, very effective, between 10 to 12 sessions. It would massively help your conditions such as arthritic joint in the knee, plantar fasciitis, Achilles tendonitis, shoulder, frozen shoulder, bicep tendonitis, obviously in the neck for the joints, fasciogenic pain in the lower back, low region, pelvis region is that low tailbone pain. As you see, it's a 1.6 because it's closer to the surface. It decreases the intensity. Foot, obviously, we talk about plantar fascia. And elbow, in this case, we're going to push elbow intensity, and you could increase the per body part. Obviously, us as clinicians, we are trained how to use the machine for the various conditions, so the pulse changes. But on average, it's about 1,000 pulse per treatment. It's already preset for the frequency and the depth of the shock wave treatment and number of pulse. So it's very easy. This patient has tennis elbow, tendonitis of the extensors. So she does a lot of typing and she has some pain coming from the neck down to the arm. So combination of a neck radicular pain, weakness here, and repetitive movement, she's developed a tendonitis in this region. So just like ultrasound, we have to use a medium, which is the ultrasonic gel. Basically, the gel we use to apply the shock wave. It's very actually simple and painless. You want it to have some pain, and we're going to go ahead and ask her as we start the treatment. The sound you hear is the pulse wave. And I'll go ahead and move the gel around and find the sore spot. Last time I found it was more. You feel anything? I think you felt about 2.2. This is her second session. How's that feel?
Yeah.
But again, remember, this is second session with pulse wave, and she's also had 3 sessions of physical therapy in combination with this, where the physical therapist has worked on the neck muscles, shoulder muscles, and I've treated some of the radicular component of it. But pulse wave, basically a series of pulse. As you notice on the screen here, the number of times that the pulse wave works is shown here. Usually about an average 1,000 pulse for joint.
You're right there.
Right there.
Yeah.
So how much better do you feel after the first treatment? This is the second one.
Yeah, I definitely feel the difference between the first and the second.
And then has it helped you with your work? Is less painful at work?
Yeah, even like my day-to-day.
And I remember you told me you even got some injection right into the area.
Yeah.
So comparing it to the injection, which one has been more effective in your opinion?
I think the injection lasted like a month, and this has been over like 4-6 weeks now.
Perfect. Yeah. And you combining it, obviously working with the radicular component coming from your neck, it has made it probably more effective. So very simple. The average treatment is anywhere between 8 to 10 minutes. And as you get used to the pulse wave, we could increase the intensity.
Yeah. Ooh,
Yeah.
it cracks. It feels so weird, but like it's good weird.
Okay, and then you could take more.
Yeah.
Wipe
I
it
got it.
yourself. Yeah. Pulse wave therapy, very effective in musculoskeletal disorder.